Let me wish you a very happy and prosperous new year. I am Dr. Saumya Srivastava, Head of Department of Obs and Gynae, Ahalia Hospital, Musaffa. As we all know that January is celebrated as Cervical Cancer Awareness Month, I want to take this opportunity to raise awareness against cervical cancer and HPV vaccination. Cervical cancer is one of the most common cancers affecting females from the age group of 35 to 44. This cancer is caused by a virus which is called human papillomavirus. This virus is usually sexually transmitted and the infection starts with the onset of sexual activity. Normally, this infection would get cleared from your body within few months because of your own natural immunity. However, in some cases, this infection may persist. Now, this is the time when this infection will cause changes in the cervical cells, which are usually precancerous. This change, if left over a long period of time, changes to cervical cancer. Now, I want to tell you what we can do to prevent cervical cancer. There are two things that we can do. We have a very effective tool which is called the HPV vaccine against human papillomavirus infection, which is responsible for cervical cancer in 95% of the cases. This vaccine is given to children starting from 9 years of age until 15 years of age in 2 doses 6 months apart. This vaccine can also be given after 15 years of age, but now we need to give 3 doses. Apart from vaccination, what else can we do? The second tool that we have is cervical cancer screening test, which is called Pap smear test. This test can be done in the outpatient department. It's a very easy test and painless as well. It just takes few of your minutes. You can come to the hospital, get your test self-tested according to the schedule that doctor will give you. Now, when do we start the screening? The screening for cervical cancer starts at 25 years of age and is done every 3 years until you are 50 years of age. Thereafter, the screening is done at 5 years interval until 65 years of age. Now, what happens if the test is not normal? If the test is not normal, the doctor may suggest you to do a secondary test, which is the human papillomavirus detection test. As I told you that this virus is responsible for cervical cancer in 95% of the cases, this will tell us if you are having HPV infection or not. According to your report, the doctor is going to suggest the treatment and give an effective treatment will help to cure the cancer. Now, these are the two tools that you can use to prevent cervical cancer. So the take-home message is that cervical cancer is easily preventable if we do the screening as per the guidelines and take the vaccine as advised, along with some measures like avoid smoking. So in 98% of the cases, you can prevent cervical cancer. So do screening and stay safe. Thank you.